Substance abuse video 1AA. 1B drives into substance abuse and mental illness. Modern medicine considers them one and the same. There's a pretty place in 1C, the world's status of mental health. We're going to go into what country has the best mental health. And yes, I'm using a cheap recorder because it's easy. Okay, now this is video 1AA, a segment, a part of 1A. It's introductory video, complex statistics, connection between mental health and substance abuse. It's just the finish of 1A. It's the complete version. You don't have to follow 1A to get this. It's all just statistics and interesting stuff. Okay, to begin, often certain drugs can create problems that trigger mental health symptoms. In other cases, substances can create mental health symptoms like paranoia, delusion, depression, or the person is under the influence of the drug. When these symptoms last after the drug wears off, then it can indicate a co-occurring mental health disorder. So let's say you smoke some Mojo, which is, that's a good example actually. Mojo. Let's say you smoke some Mojo. Mojo is synthetic marijuana that the DEA has been cracking down on. And if you do not lose the paranoid state, the delusional state that it often induces, you could be considered a co-occurring mental health disorder. Okay, drug abuse and addiction have negative consequences for individuals and for society. Estimated total cost of substance abuse in the United States, including productivity and health and crime-related costs, exceeds $600 billion annually. This includes approximately $193 billion for illicit drugs, $193 billion for tobacco, and $235 billion for alcohol. $235 billion for alcohol. People who move here from abroad quickly increase their risk of mental health problems, especially if they do not live in native ethnic communities. Minorities tend to have lower levels of mental health problems despite their lower economic status, suggesting that the social support they provide each other is protected. That's the truth. Fact of the matter is, minorities tend to have lower level mental health problems. Now, there's some indication that maybe it's not always diagnosed, maybe it's not always seen, but there's a lot of proof that the connected support in communities can be a remarkable thing. Although parallel studies in 27 other countries are not yet complete, the new number suggests that the United States is poised to rank number one for mental illness globally, researchers said. Yes, Mr. Bush, we are number one in mental illness, in jails, in so many things. But no, seriously though, out of 27 countries, we are number one in mental illness. And United States, and I'll tell you why. And not everybody who works for this organization is actually from the United States, but you know, there's actually an article that is probably going to be documented that displays that why the United States has such high mental illness rates, and it's incredibly informative. Okay, mental health disorders in the United States. Over a 12-month period, 27% of the adults in the U.S. will experience some sort of mental health disorder, making the U.S. the country with the highest prevalence. Mental health disorders include mood disorders, anxiety disorders, attention deficit disorders, and substance abuse. Over one's entire lifetime, the average American has a 47.4% chance of having any kind of mental health disorder. That's right, almost 1 in 2. After the age of 75, it's 55%. The WHO data does not take into account eating disorders, personality disorders, and schizophrenia, which is 15% of the U.S., according to the National Institute of Mental Health. Let's go on. The connection between mental health treatment and substance abuse treatment. 67.4 million people in the U.S. sought medical treatment at doctors' offices, public health clinics, and emergency rooms for a mental illness. 67.4 million. That's awful. States cut $5 billion in mental health services in 2009 and to 2012. In the same period, nearly 10% of the total supply, says one director, was cut from psychiatric hospital beds. That's 4,500 beds. That was cut. 10% was cut. Many with the untreated mental illness are just too sick to work. Incel notes that 44% of those receiving federal disability payments have a serious mental illness. 44% of the people receiving disability, which is a huge markup, is mentally ill. Drug use is on the rise in the country, and 23.5 million Americans are addicted to alcohol and drugs. That's approximately 1 in every 10 Americans over the age of 12. Roughly equal to the entire population of Texas. And if you are from America, you know that Texas is a big state. But only 11% of those people, of those with an addiction, receive treatment. This was journaled and marked September 28, 2010. New health rankings of 17 nations. U.S. is dead last. We're talking about death from all causes. Still, we have some superior traits, but we have some great work in cancer done. We have some, Nobel win, which is just some fantastic people. But overall, Japan is leading, and we are falling behind. Mental health workers per 100,000 people. Europe has 43.5. America has 16.7. The global is 9. And Africa has 1.4. West Pacific has 8.7. Eastern Mediterranean has 4.8. South Asia 7.3. But Europe is right now going through economic trouble with jobs. But then again, who the hell isn't? There's always some place that has problems with economics, but at least Europe is trying to take care of every problem that they have. I'm sorry. The World Health Organization surveys of legal and illegal drug use in 17 countries, include the Netherlands and other countries with less stringent drug laws, shows America's report the highest level of cocaine and marijuana usage. Let me repeat that. Despite tough anti-drug laws, a new survey shows that the U.S. has the highest level of legal usage in the world. The World Health Organization survey of legal and illegal country drug companies of 17 countries, including the Netherlands and other countries with less stringent drug laws, show America's report the highest level of cocaine and marijuana use. So, does spending more money and having more laws really lower the usage? Apparently not, according to this. Now, for example, Americans were 4 times more likely to report using cocaine in their lifetime than the next closest country, New Zealand, 16% versus 4%. Globally, drug use is not distributed evenly and is not simply related to drug policy, since countries with stringent user-level illegal drug policies did not have lower levels of use than countries with liberal ones. Researcher, God knows how to pronounce that, of the University of New South Wales, Australia, and colleagues write in the PLOS Medicine. Forgive me, Australia. Tobacco use was almost common. Was also most common in the U.S., 74%, followed by Lebanon, 67%, and Mexico, 60%. That's right, we have the highest. It's incredible. The use of drug use to be a feature of more affluent countries. The U.S. which has been driving much of the world's drug research and policy agenda, stands out with higher levels of alcohol, cocaine, and cannabis, despite its punitive illegal drug policies, as well as in many U.S. states a higher minimum legal alcohol drinking age than many comparable developed countries, write these researchers. So, drug use is absolutely not necessarily poignant. It's not necessarily set on how much laws. That's what the evidence shows. I know I can show you evidence that shows other things, evidence that contradicts this. There are reasons. I mean, the possibilities are just impossible to imagine. And I know I'm getting my tongue tied, but I'm going to say good night, goodbye, and good mental health.